Previous research has shown that a crucial way in which child protection is achieved is by practitioners getting close to children, physically, emotionally, especially on home visits.
Research began in April 2020 and followed the experiences of a sample of 48 social workers, family support workers and managers in 4 anonymous local authorities in England until December 2020.
How is it possible to keep children safe at a time when the COVID-19 pandemic required social distancing?
We also collected data on work with selected families over time to see how relationships were affected by COVID. We interviewed 21 parents and 1 grandparent.
One of the key ways that social workers and family support workers coped with social distancing was to shift their casework online.
During COVID and due to social distancing, all of our data was also collected remotely. We relied on social workers and family members to describe their encounters and help us and our audience visualise what occurred. The reconstructions using actors in this film are based on actual interviews with social workers and parents.
There were particularly high risks that became apparent quite early on in the pandemic for families and workers from black and minority ethnic backgrounds.
I know in my head there's this COVID thing and so many ethnic minorities, we're seeing on the news that more and more of them have died. They're succumbing to this illness. But knowing that, and then in my heart that I have to help kind of overrides all of the knowledge that I have about COVID-19 and the risks. I do worry, when I'm driving home and my clothes, what am I carrying? Sophie and I had to remove 2 children and they sat in my own children's car seats. You can't get much closer to my family than that. I'll probably do it again. I had the gloves on. One of them was 4 months, one 3, and they both had to be lifted into the car. I work from home, my bedroom. There's nowhere else to work from. So I work from my bed and my writing pad that I take to visits, my pen, they all go on the bed. My bag, it's been to 8 families. I've got 3 kids of my own and I do worry. One of them's at nursery, 2 are at school. Potentially, we are super spreaders.
The homes that social workers visited were invariably small, and this was related to the fact that the families were living in poverty. And there simply wasn't enough space, enough room to maintain a 2-metre distance, especially when a family was all together in the home. Social distancing was often impossible to maintain because children, and especially younger children, didn't understand the requirement for it.
They came over and they smiled at me, and the little boy was lying on the floor and playing peekaboo with me. So he was quite close, but I tried not to touch them. But apart from the visit last Friday when the little girl, she came right over to me and she put her head on my knee. It is really difficult with little ones. You don't want to frighten them because we're here to help them and they need to know that. But at the same time, I think it was kind of a comfort thing. She wanted to put her head on my knee, and I think somehow that she knew that I was here trying to help.
When it became evident to the worker that the children needed that tactile engagement, workers would reciprocate by allowing the children to hug them, to make that physical contact with them. And it wasn't just younger children who behaved like this. Some teenage children we heard about chose to, for instance, sit down on the settee beside the social worker, despite there being room elsewhere, on another chair, another settee, in the sitting room or wherever the encounter took place. This kind of nurturing response that social workers and family support workers provided for children during the pandemic was really important. But due to the restrictions of social distancing, and in some instances the barriers in communication brought about through face masks, meant that it just wasn't possible for social workers to achieve that same level of closeness in all cases that they were able to pre-pandemic. And due to this, it's likely that the harm that some children were experiencing was missed. The pandemic caused increased problems and stress in a range of ways for many children and families, including food poverty, anxiety, depression, eating disorders, and a range of mental health problems. Jane had suffered with mental health problems and had difficulties coping with the demands of caring for 4 children on her own. From the beginning of the pandemic, the social worker was the only person from outside the family that she and the children had any face-to-face contact in person for several weeks.
My boys wouldn't have ever spoken to a social worker before. And my oldest, who was probably the hardest work, my 16-year-old, who we've been trying to get back in line, he wouldn't usually message, but he bonded with Ben enough to message. So, you know, if we rowed or if the boys rowed between each other, you know, well, that was a big problem. So with the boys rowing through lockdown, it's hard, you know, to keep like 2 15 and a 16-year-old locked in a room all day. It was complicated at the beginning. It was a complicated time. It was a very small area and they couldn't go out and stuff like that. But my eldest, he would message social if he was upset. I gave him someone to talk to. I gave me that. Because when I was at home and I was distressed and fuming and sick of it all, well, it gives you someone, doesn't it? And someone there to message or ask for support. And Ben's great with advice. He gives advice which is really positive. So if he can't solve something, just knowing that you've got someone there to tell or something to say is a massive help, I feel. We are really lucky. I think it were on that first week of lockdown when I was really, really poorly with COVID. And in that time, nobody came to visit in that 6 weeks. But Ben did visit. We did outdoor visits. My family couldn't come because of my mum. She's on the at-risk because of asthma and stuff like that. So we were a bit lost. It was tricky at the beginning. But Ben did this really good thing, I think. And he'd go into the front garden and we would sit at the front and we would talk. And that was nice, I think. It was nice to have a bit of adult support, really. I think he was probably the person brave enough to come and visit us. So that was great.
Violence against women increased, as did other problems in families. And one consequence was that at some of our research sites, the numbers of children taken into care also increased. Often social workers were the sole professionals doing home visits. Serious child harm cases reported by councils in England rose by nearly 20% during the first year of the pandemic, including a 19% rise in child death notifications, 36% of these notifications involving children aged under 1. Despite all the barriers caused by the pandemic and social distancing, social workers did manage to develop meaningful relationships with children and families and have a positive impact on many of their lives, including in high-risk, complex child protection cases.
The children were on a child protection plan due to the father, Ray, abusing his wife, Susan. There were concerns about emotional harm to the children and poor standards of care. The children had a domestic abuse social worker who had stopped visiting during the virus. So the school called over the phone to speak to the children and their mum, but the phone was put on loudspeaker by Dad. So it becomes quite difficult then to get a true picture because we're really aware that the calls are being listened into and we might not be told everything because he's there listening. He said, "I create problems in the family to warrant my existence. I'm sick of hearing your fucking name."
Oh no! Let's go. You're always round here. You're always getting on our nerves.
If you could just give me just a few minutes.
Go on, just do
5
one.
more minutes. Just if you just let me in, just for
All
it
right,
will literally
not 5
be
minutes. 5 minutes.
Okay. Thank you. Thank you.
Hello.
Hi. Hi. Hello. Hello. How are you? How's everybody today?
Yeah, hi, yeah.
Yeah. Hello. Hello. How are you?
Good, aren't you?
Hi, yeah.
Care of the 3-year-old has improved and was now good enough. There's been no domestic violence incidents for 5 months, and the father has stopped drinking because he doesn't want to lose his kids.
On visits during the pandemic, we've admitted there's a few things that could be changed in our house. There's no manual about being a parent. It's been quite hard. I'm not one who likes to be told what to do. She has been helpful. She's got us to see there are things we have to change. She sourced a bed. She's going to get us a cot. Every case is different, and with the one we've got, she's come in and rather than stereotyping, she's looked at it in an individual way. So I think that's helped. She's helped me when I said I can get help with a bed. I'm a proud man. She's not trying to tick the boxes. She's had her list. She's had some things that people have told her to do, and she didn't bother going through them all. Some social workers go through it even if they don't need to, because they've been told to. The previous social worker didn't interact with the children. The one we got now interacts with all of us. The other social worker would snatch her bag away. Current social work interacts with the children, asks how they are, brings them little bits, games, clothes, talks to them directly rather than through us, and she walks through the house.
Yeah, I think we've got a good relationship. We're upfront with each other. She hasn't judged, and she's been tough when she's needed to be. She doesn't hide things. She's upfront no matter how hard it is to hear, which has really, really helped. There have been times when we haven't wanted to hear the things that she said, but she's wanted things to change that we don't want to. But she's honest with us, and we work together to find solutions, but she's understanding as well.
One of the key ways that social workers and family support workers coped with social distancing was to shift their casework online. They used WhatsApp and other digital platforms to undertake digital home visits. Using video calls meant that they could speak to the parents, they could interact with children, and they could be shown around families' homes, while still working from the safe spaces of their own homes during the pandemic. Initially, a lot of social workers were sceptical about doing digital social work. They missed the sensory and the non-verbal cues that they experienced when they visited families in person in their homes. They also worried about what they couldn't see through the frame of the video, what was happening outside, what was visible on the screen. In this case, the baby was born before the lockdown, and when it was 5 months old, there was a GP referral with concerns about parental conflict, potential domestic abuse, and mother's depression.
So this is the baby that I was talking to over video. I seemed to get myself really, really close to the screen, so my face was really big and my gestures were really over the top, which the baby really responded to, giggling and babbling away yesterday. And the parents seemed supportive of this. They held the phone really close to the baby so she could see me. I think in terms of how I'm working with the parents, it wouldn't be any different other than I'd be in the room with them rather than on the end of the phone. But for the baby, it's more about the facial expressions, the eye contact, the close-up, getting their attention, tickling their cheeks, stroking their hand. And I'd be more inclined to do this in a home visit. That's the main difference. Well, maybe interact with a toy.
The social worker worked with this family exclusively online. During the video call, she used facial expressions and eye contact to connect with the baby, and she felt that she'd been able to connect sufficiently to be able to assess the case in this way.
Well, so far since social services involvement, we have started communicating better, and I think since then we've managed to have a good understanding, and things are 200% to 300% better than it was. The social workers never visited in person. They came on video WhatsApp and talked to us a lot and gave us a lot of advice, such as, well, if things get heated, someone has to walk out and not come back until you feel calm. But I think they were very helpful, very observant of what's around and how the baby's behaving. Yeah, it was good, very helpful. When we talked to them after the baby was asleep and they said we'd call a bit later on, they want to talk to the baby as well, you see, so they want to see the baby's movements, and they talk to the baby, and You know, she'd be looking at the screen and she'd say something and be playful. Yeah. She was about 8 months old.
But in fact, some service users preferred communicating digitally with their social workers, and many found digital social work to be very helpful. Ultimately, many social workers also recognise the benefits of doing social work digitally. Another beneficial use of digital technologies and media is a hybrid approach to social work. Social workers use video, texting and phone calls in combination with in-person meetings, either at families' homes or elsewhere. This baby was born during the lockdown, and once the parents arrived home, they started to send the social work photographs and to text her, particularly when they needed reassurance, which helped to give them the confidence that they needed.
I think it's a good relationship. They will contact me a lot. If they were unsure about anything, they'd text me. They did so at 10 p.m. one night, just for reassurance about the baby and to gain confidence. They're certainly reaching out, and I now don't feel particularly anxious about the care of the baby. She's thriving, laid back, and they're doing really well. They sent me a text the other week to say they couldn't get any formula milk. So last weekend I popped to the local shops, picked some up and dropped it round to them Saturday. I'm very aware of how families who don't have a car and who are living in poverty don't have access to a range of shops. If this were normal times, I'd certainly have had a cuddle by now. And I get her to try and follow my face and look at my facial features. She does recognise my voice, and Mum and Dad says that she does now recognise me. If it weren't for the pandemic, I'd be more hands-on. I'm a natural hugger.
By December 2020, at the end of our research, the social worker was ending her involvement in this case. When we interviewed the family, they told us they were also very satisfied with the way that she'd been able to help them during the pandemic.
Social workers often moved the home visit away from the interior of the home. So when families had access to outside space, visits often took place in gardens. And when they did not, or when a social worker wished to speak to a child or other family member individually, they often went on the move. So walking around streets, parks, woods, etc.
I mean, over the phone, it can be so monotone and horrible, and you don't really get a real feel of the situation. And particularly with her, she can become very... She's a very humorous girl, but she can get quite aggressive quite quickly, and not necessarily aggressive with me. She can be aggressive with how she talks about things. So as we walked along, we found that we was able to almost kind of physically bounce off each other, or slow down or speed up. But you were able to react more naturally to what she was saying, which I found helped. And she seemed to really respond to that. And she was almost leading the way as we was walking to the park, and we sat down at the bench, you know, as we usually do. And at that point, we don't really speak that much, it's quite nice. It's quite nice because it shows me she's not really resisting any of that. She's very much in the moment.
The COVID-19 pandemic had a profound effect on many services, some of which shut down or moved to offer only remote support. Whereas social workers and social work organisations adapted rapidly and creatively to meet new challenges and to continue to support children and families. But working continually and in isolation had a cumulative effect on social workers. They cope with these impacts by creating their own support digitally, checking in with one another on the phone, creating their own staff WhatsApp groups, or meeting on video calls. But the crucial in-person peer support from working in an office and the thinking spaces between home visits that had helped them cope with stress were missing, and in some local authority areas missing for extended periods. Some social workers felt burnt out, some left child protection work, and some left social work altogether. These impacts were often missed by policymakers and were invisible to the public. It is vital that these professional contributions and personal sacrifices made by social workers during the COVID-19 pandemic are publicly recognised, and that leaders and organisations learn from them, so that the real experiences of child protection social work are accounted for in the design and planning of responses to future emergencies.